My name is Anita Benefor, and I am a placement student at For a Safer Space. I will be presenting what is autism. Autism, also known as Autism Spectrum Disorder or ASD, is a neurodevelopmental disorder that impacts the brain development. The result is that most individuals experience a communication problem, difficulty with social interactions, and a tendency to repeat specific patterns of behavior. They may also have a markedly restricted range of activities and interests. Autism spectrum disorder is typically accompanied by co-occurring medical conditions such as epilepsy, sleep disorders, gastrointestinal abnormalities, and immune dysregulation. Mental health issues such as anxiety and depression are also common. Any of these conditions may severely impact an individual's quality of life. So people who are autistic typically need support in all areas of their lives. The term spectrum refers to a range or continuum of severely or of developmental impairment. Children and adults with ASD may have particular characteristics in common, but the condition covers a wide spectrum with individual differences in the following. The severity could be mild to severe, the age of onset, so when it was discovered, levels of functioning, and challenges within social interactions. So to summarize, autism is not a one-size-fits-all disorder. There are typically different ranges upon everybody that is within the spectrum. So no two cases are alike. Everybody is different. There are some people that are very high functioning who don't need as much support, and then there's others that need a lot of support and can't be unsupervised at all. Individuals on the autism spectrum tend to have varying degrees and combinations of symptoms, and therefore treatment must be specific to the individual. It is also very important to keep in mind that children, teens, and adults with autism vary widely in their needs, skills, and abilities. There is no standard type or typical person with ASD. According to the National ASD Surveillance System 2018 report, autism prevalence amongst children and youth in Canada, an estimated 1 in 54 children and youth between ages 5 and 17 years of age have been diagnosed with ASD. The report is based on a 2015 health, educational, and social services data collected from the 7 participating provincial and territorial governments, representing 40% of children and youth in Canada. Attention has recently shifted away from the focus that it was almost exclusively on early diagnosis and interventions in young children on the spectrum. Autism is a lifelong condition. Society needs to recognize that adults on the spectrum deserve appropriate medical care, social support, and educational accommodations, employment opportunities, and housing. So, typically when you hear autism or you see images of people who are autistic, it is catered around children. We are trying to change the narrative of autism because, again, it is not something that could be cured. It's more so something that needs lifelong support. So we have to also look at how it is being pushed in the media, right? Like I said prior, autism, when I think of it, or before I started working in a environment with autistic children, I only associated it with children, but there's many adults that are dealing with autism and don't have a lot of supports, or maybe are not aware of the supports available to them like they do of supports available for children. So some early signs of autism, specifically from 12 months to 24 months. The child starts to learn language but can't retain it, or they don't grasp it at all. They appear deaf, have slow response times and cues, or don't respond at all. They avoid eye contact when spoken to or when you are pointing at something or to someone. They have a lot of temper tantrums, meltdowns. They self-harm, a lot of defensive behavior and aggression, especially when they don't get their way. They are unable to self-regulate their emotions when they're upset or when they're going through changes or transitions. So, for example, there's one child that I work with. he has a very difficult time if he is not told ahead of time what his next step is. So we have created a program or like a routine that he follows throughout the week on days that he has school, and then he has a routine when he comes home from school and on the weekends. If that is changed in any sort of way without giving him prep ahead of time, he has a very difficult time. He will have meltdowns. There will be a lot of heightened behavior and a lot of aggression. Poor sleep patterns and frequent disruptions while sleeping. So this client as well, there are times within the month where he will wake up more often in his sleep to go use the bathroom, or he'll just stay up all night and he will, cause disturbances in the house, make noise, stomp, yell to get attention, a lot of attention-seeking behaviors. But it regulates depending on who is working with him. But again, he needs constant supervision and he needs to follow his routine. If his routine is disrupted in any sort of way, it causes a lot of chaos for him. Specifically, if certain staff are on board who are not familiar with his routine, that typically tends to disrupt his self-regulation patterns. Some other signs are the child does not make eye contact when being spoken to. They show little to no interest in interactive games such as peekaboo or hide and go seek, or just any sort of games that children typically respond positively to. They strongly dislike or resist hugs, kisses, or being consoled by parents, family, or friends. They display a lot of repetitive behaviors. So it's almost OCD-like behavior. Stimming, rocking, flapping, spinning, rocking fingers, pacing back and forth, things like that. They could also do things like switching light switches off and on, opening and closing doors, going back and forth to different rooms to check to see if everything is in place, making sure things are organized in a specific way or by color or by pattern, wanting to have a certain amount of juice or water in a cup, wanting to do things on their own. And if you do it for them, they will have to go back and fix it themselves until they are satisfied. Some other things are they can be very fussy, picky eaters. They also have chronic gut issues. Some associations with social relationships and autism. So autistic youth typically have very low awareness or lack of awareness in social settings. Autism is characterized by an impaired ability to engage in social relationships and can result in serious deficits in the ability to make friendships. In fact, children on the autism spectrum often behave as if other people do not exist. This is demonstrated in various ways, including failure to respond to their names when they're called, appearing not to listen when spoken to, an inability to display appropriate facial expressions, avoidance of eye contact, a failure to respond to affection, and sometimes treating people as if they were inanimate objects. Often children will acknowledge an adult only for the purpose of getting a need gratified, or will return to ignoring the adult thereafter. So another example I have, certain clients that I work with, like I just stated, they will not respond to you. They will not listen to anything you're saying unless they are trying to get something from you. So let's just say the child wants to use the computer or wants to use the iPad, but they have been, displaying like disruptive behaviors. So they will behave for a minute or two or for 5 minutes so that they could get the iPad. And then once they do get what they want, they go back to reverting to their old behaviors. So they are very smart. There's a lot of assumptions with people who have ASD that they are stupid or that they are unintelligent, but no, that is very far from the truth with a lot of them. They are very intelligent people, and unfortunately a lot of adults or caretakers or professionals tend to kind of underestimate that about them. Some other social relationship characteristics are they are unusual in seeking comfort when stressed, unusual seeking of comfort when in stress. They tend to crave predictability and function very highly in structured routines. They can become extremely dependent on routine in their lives, which makes coping with changing in their environmental or routine highly difficult. So again, when there are abrupt changes in their lives, a lot of them do not know how to cope with that. You will see a lot of maladaptive behaviors or aggression towards the professional or even family, friends, or caretakers when their routine is broken. They have impaired imitation skills. So most young children will respond and exhibit gestures and playful overtures when playing with peers. Most kids who are autistic, however, fail to respond to those things. So they will imitate negative behaviors that they pick up on or they see their peers and adults do, as opposed to picking up positive behaviors. They also use toys in unusual ways. They might, if it's like a puzzle, not puzzles. There's a client that I work with, for instance, who likes to play with Jenga blocks, but he doesn't set them up to play the game properly. He piles them like dominoes so that he can hit them on the floor, and then once they all fall down, he repeats the cycle, which is fine. That's just his way of playing the games. But typically, they tend to use objects and toys in unusual ways. They also have an inability to form normal friendships. And I put normal because, normal is subjective. They have an inability to relate to peers in a positive and reciprocal manner. And they also have an inability to adapt to interpersonal skills to the various demands of different social situations. So again, when they are with other people, they tend to be very awkward. They might not be doing it on purpose. That's just the way that they function. But because of that, maybe when they are in social settings, many peers will not gravitate towards them because they might be, they might do things that are considered strange, or they might not know how to share. For instance, when they go mingle with a group of kids and they're playing with toys, or they might have their own toys and they just seclude themselves. So other kids might want to come and play with them, but they choose not to interact, or they just act like the other children are not there, or they take toys away from other kids. Whereas, kids who don't have ASD typically understand social cues and know that if somebody is playing with something, even if they do want it, they can't take it. They would have to ask. So, critical use of language and autism. Each person with ASD is unique. There is not one size fits all standard or case. No two cases are the exact same. So when using words to describe people who are autistic, we need to be very careful, because terms such as mild or severe and labels like high functioning and low functioning aren't always accurate and can be viewed as harmful to the individual, which can cause very low self-esteem. A client that I work with, because he hears staff say things like, he's low functioning, sometimes he will say, my brain is not working, I am stupid, or am I dumb? Because he has heard these things in the school setting. So he internalized that and he believes that. So when he is having difficulty processing something or having a bad day, he does not understand that his brain just processes information a lot slower than somebody who does not have ASD, but he will take that as he is dumb. Each person has different strengths and weaknesses. However, when working and raising a person with ASD, one must focus and center their strengths to remove the stigma around the diagnosis. So some strengths of kids who have autism or adults who have autism are their nonverbal reasoning, the ability to understand and analyze visual information and solve problems using visual reasoning. They have exceptional memory, perceptual motor skills, so hand-eye coordination, body coordination, auditory language skills, for example. Computer and technology proficiency. So there was a client that I used to work with. He was extremely intelligent or knowledgeable when it came to cars, different cell phone models. He could literally draw the model. Like if he asked you what phone you had, he didn't need to have the phone in front of him, and he could draw out every single detail and label everything on the phone. But when it came to communication skills, like, hey, how are you doing? How is your day? And things like that, he would not be able to complete a sentence or have like a thorough conversation with you. Some other skills are exceptional skills in creative and imaginative expressions. So musical talent, art, writing, drama, they typically can be very talented in those areas. And visual-spatial ability, so capacity to identify visual and spatial relationships amongst objects. So when it comes to the diagnosis, in North America, medical professionals use the 5th edition of the DSM, which stands for Diagnostic and Statistical Manual of Mental Disorders, DSM-5, revised in May of 2013 to evaluate autism. Autism diagnoses are based on a combination of specific behaviors, communication delays, and or developmental disabilities. Parents, family, and caregivers of autistic youth are typically the first to notice delays in quote-unquote normal childhood developmental milestones such as speech, eye contact, and social interactions or social relationship skills. Sometimes autism goes unnoticed and undiagnosed in both children and adults, especially when symptoms are mild or when the person has other disabilities or health problems. In some cases, making autism very difficult to recognize. As a result, ASD may go undetected for years and may only be diagnosed during an educational impasse or a life crisis, which puts a person in contact with a professional who is able to recognize the disorder. So a lot of the times, young school children maybe start doing school or go to kindergarten or grade 1, grade 2, and then the teacher or maybe like a social worker are the ones to point out to the parents that your child might be a candidate for autism. And then that's how they are given their diagnosis. And some co-occurring conditions with autistic individuals. I'm just going to name a couple of them. Seizure disorders, autoimmune conditions, asthma, eczema, allergies, ear infections, and respiratory infections. Some behaviors which may indicate a co-occurring condition: sudden changes in behavior, aggression, covering ears with hands, loss of acquired skills, irritability or moodiness, frequent night walking or difficulty falling asleep, teeth grinding, walking on toes, tantrums or oppositional behavior, self-injurious behaviors like biting, hitting, slapping, head banging, chewing on clothes or objects, vocal expressions like moaning, whining, groaning, sighing, posturing and seeking pressure, and repetitive rocking and other movements. And some screening tools to identify autism are ages and stages questionnaires, communication and symbolic behavior scales, parent evaluation of development status, modified checklists for autism in toddlers, screening tools for autism in toddlers and young children, observation tools such as autism diagnostic observation schedule, the childhood autism rating scale, and the autism diagnostic interview. Again, screening tools are designed to help identify children and adults who might have developmental delays. They do not cure ASD, but help find appropriate resources to improve the quality of life for individuals and families living with ASD. Thank you.